So good evening, my dear doctors. So this session is for MBBS students who are in their first professional examination. So today's topic is calcium homeostasis. This question can come as a long question, full marks, or it can be asked like a short notes and very important topic for MCQ also. So without further ado, let me start the topic calcium homeostasis. What is the normal value of calcium in the blood? If they are asking in milligram per deciliter, then answer will be 10 milligram per deciliter. So it will change according to the units. So if they are asking in the milligram per deciliter, which is most commonly used in the lab reports, it is around 10. We can say 9 to 11, 9 to 11. But just to remember, you can remember 10, 10 milligram per deciliter. If they're asking in milli equivalent per liter, then your answer will be 5. It is easy to remember 10, 5. And if they're asking in millimole per liter, then answer is 2.5 millimole per liter. But most commonly used is 9 to 11 milligram per deciliter. Now, out of total calcium, only 50% of the calcium is free or ionized. Out of total, only 50% is free or ionized, and this is the form which is physiologically active. Rest 9%, they are complexed with the anion. 41% protein bound with the albumin or with the globulin. So 50% of the total calcium is the most important one because it is physiologically active form. So what are the various function of calcium? There are multiple function. It can act as a secondary messenger. Okay. Calcium is the secondary messenger for GQ receptor. If you remember, inositol, triphosphate, diacylglycerol, and the secondary messenger is always calcium. For GQ receptor, so all those hormone who are acting on GQ receptor will act through calcium. It can be gonadotropin releasing hormone. It can be oxytocin. It can be ADH, which is working on V1 receptor. It is in the blood vessel and causing vasoconstriction. That is why it is also called as vasopressin. So the first function to remember for your exam regarding calcium is it is acting like a secondary messenger, number one. Number two. Number three is muscle contraction. If you remember, troponin C is the protein. Troponin. It is the troponin C which can add with the calcium and it will cause conformational change to uncover myosin binding site on actin filament and it will cause contraction of the muscle. So the trigger point for skeletal muscle contraction here, of course in the smooth also, but here in the smooth muscles, calcium will act through calmodulin. Calmodulin. So either they ask you in the skeletal muscle or in the smooth muscle or in the cardiac, everywhere calcium is needed. Okay, proteins can be different, but calcium is needed for muscle contraction. It can be skeletal, smooth, whatever. Okay. Now, next is exocytosis. If you remember, the insulin is released through exocytosis. In the neuromuscular junction, there is exocytosis of acetylcholine. So wherever there is exocytosis, one cation is always needed, and that is calcium. So the next function is exocytosis, and the most important one is stability of the nerve function. Calcium stabilizes voltage gated sodium channel. So it will stabilize your neuron, your muscle. All the excitable tissues are stabilized by the calcium. And these are the 9% complex to the anion. It can be with the citrate, phosphate, or bicarbonate. Rest can be protein bind with albumin or globulin. They are non-diffusible. 1 gram per deciliter increase in the albumin will increase calcium by 0.8 milligram per deciliter. This is, I'm telling you, because whenever there is hypocalcemia or hypercalcemia, we can adjust the value of calcium by this formula. This is the formula for that. Now, coming to the calcium homeostasis. Hormones are in stasis. Third is calcitonin. Now, if we see the function of various hormones in the calcium homeostasis, parathormone decreases one thing and increases the other thing. What is that? It increases calcium in the blood and decreases phosphate in the blood. Please do remember, parathormone has opposite action on the calcium and phosphate. In the calcium will be increased and phosphate will be decreased. Vitamin D3 active form calcitriol. It is the active form of vitamin D3. Okay. This is not only increasing the calcium, but also increases the phosphate. So both will be increased, calcium and phosphate serum level, blood level. Okay. Third is calcitonin. Calcium is decreased by calcitonin. So these three hormone interplay to maintain blood calcium, and it is one of the most important chapter. If you remember the concept, you can write whatever amount of matter you want to write, but concept is very important. So this is the major concept I will discuss in more detail. So the first hormone, parathormone, increases blood calcium and decreases the phosphate. Calcitriol, vitamin D3, the active form. It not only increases the blood calcium, but also increases the phosphate level. And calcitonin always decreases blood calcium level in the blood. Okay, now we are going to discuss one by one. First, about parathormone. So parathormone hormone have action, two types of action. One is direct action, other is indirect action. Indirect action, direct action is on bone as well as kidney. So parathormone is acting directly on the bone and kidney. I will discuss in detail how they are acting, what you have to write in the exam. Indirect action is on intestine. Okay. So there are three types of action, two types of action, direct and indirect. And directly it is acting on bone as well as kidney. Indirectly it is acting on intestine. Now regarding the bone, now you will tell me parathormone act on which cell of the bone? If I ask you, parathormone is going to act on which cell of bone? What will be your answer? Osteoblast or osteoclast or osteocyte? What is your answer? You might be thinking sometimes we are throwing a guess that parathormone is increasing calcium, so it is dissolving bone. It is correct. We know that parathormone act on, it increases blood calcium acting on the bone, so might be osteoclast, isn't it? But it is not correct. Although you are correct that it is increasing the blood calcium level, it is also correct that it is dissolving bone, not good for bone. But receptor of parathormone is present on osteoblast, not an osteoclast, osteoblast. And from here, it will activate rank ligand, receptor activated nuclear kappa ligand. And this rank ligand will act on osteoclast. So ultimately, you are correct. Ultimately, you are correct that they are acting on osteoclast to dissolve the bone. So ultimately, answer is correct. It is acting on osteoclast to dissolve the bone, but through rank ligand. So parathormone's receptor is present on osteoblast, not on osteoclast. From there, It will generate rank ligand. Rank ligand will act on osteoclast, and osteoclast will dissolve the bone. Osteoclast will dissolve the bone to increase calcium in the blood. I hope this is clear. This much is clear. That rank ligand is the villain. Okay. Why it is villain? Because it is dissolving the bone. If you understand these 2 pages of calcium, you can write whatever you want to write if this much concept is clear. Okay. Now, you might be thinking that rank ligand is a villain. It can cause osteoporosis by dissolving the bone. So, how to prevent this naturally? What is the physiological way to prevent this osteoporosis? The osteoblast also releases one very important hormone, and that is called as osteoprotegerin. That is called as osteoprotegerin. It is called as osteoprotegerin. Why it is important hormone? Because this is inhibiting the rank ligand. Osteoprotegerin formed by osteoblast inhibits rank ligand, so you can say it prevents osteoporosis. So this is how it is preventing osteoporosis. But one hormone in female, that is the estrogen hormone, is also playing role in prevention of osteoporosis. How it is so? Estrogen also activate osteoprotegerin or even directly inhibit rank ligand. So estrogen also inhibit rank ligand via osteoprotegerin. So it is preventing osteoporosis. That is why after menopause, that is why after menopause, what happened? After menopause, estrogen will come down. So females are usually having post-menopausal osteoporosis. Post-menopausal osteoporosis. Okay, so if you understand this flow chart, you can beautifully write in your exam that number one step is that parathormone is acting on osteoblast cell of the bone because receptor is on osteoblast. Number two, it will generate rank ligand. It is going to generate whom? Rank ligand. It is going to generate rank ligand. Rank ligand will act on osteoclast to dissolve your bone, and increases the calcium. So rank ligand is actually working on osteoclast so that calcium can be increased, causing osteoporosis, but it is naturally, physiologically prevented by osteoprotegerin. So osteoprotegerin is called as, that is why it is called as decoy rank ligand decoy receptor antagonist. Rank ligand decoy receptor antagonist. Very simple to understand. Osteoprotegerin. Osteoprotegerin is preventing the osteoporosis by inhibiting rank ligand, and estrogen also prevent osteoporosis by inhibiting rank ligand. That is why after menopause, when estrogen is low, there is post-menopausal osteoporosis. So this is the exact way how parathormone is acting on the bone. It is called as direct action. It is called as direct action. So direct action of parathormone is on the bone also and on kidney also. I hope you will not forget now. Is this clear? Okay. So second is kidney. Second action is on kidney. How they are working on kidney, let me discuss that. Okay. So this is suppose the luminal side of the nephron. This is one cell of, let me say, DCT, distal convoluted tubule. Okay, how calcium is reabsorbed from the kidney directly. This is your calcium. Now, calcium is going from luminal side by a channel called as TRPV5. TRPV5. V5. It is TRPV5. After that, second step is that this calcium will bind with cal binding. Cal binding. Okay, it is not cal modeling. Okay, cal binding. And on the luminal side, sorry, basal side, we have a channel called as sodium calcium exchanger. Sodium calcium exchanger, and this calcium is absorbed. So how many steps are there? Three. Step number one is on the luminal side, calcium is reabsorbed via TRPV5. Second step is that calcium will bind with cal binding. And third step is that calcium is reabsorbed via sodium calcium exchanger. So there are three steps. And these steps are controlled by which hormone? Parathormone and vitamin D3. Parathormone and vitamin D3. So calcium is reabsorbed and phosphate is inhibited. The reabsorption of phosphate is inhibited. That is why blood calcium will increase and blood phosphate level will decrease in the kidney. It is happening in the kidney, and your calcium is going to increase in the blood and phosphate is going to decrease in the blood because of these action. And these action are controlled by directly by parathormone and directly by parathormone and vitamin D3. So we know vitamin D3 and this parathormone both have action on the kidney, but this is direct. So just now I have told you that on the bone and kidney, parathormone has direct action. On the other, in the intestine, it has indirect action. Why I'm telling you this? Because in the intestine also, these are the common pathway. In the intestine also, again, there is sodium calcium exchanger. There is again sodium calcium exchanger in the intestine. But in the intestine, these action are only controlled by vitamin D3. They are only controlled by vitamin D3, not by parathormone. They are only controlled by vitamin D3, not by parathormone. So why we are saying parathormone has indirect action on calcium absorption in the intestine? Because vitamin D3, the active form is calcitriol. The active form is it is calcitriol, and active form is formed from vitamin D3 in presence of parathormone. So let us discuss how it is formed. Okay, let us discuss how vitamin D3 is formed. See, when ultraviolet B rays are falling on our skin, ultraviolet B rays are maximum from 10 a.m. to 2 p.m. In the morning light is also good because there is no sunburn and all, but they have less ultraviolet B rays. Ultraviolet B rays important for vitamin D3 activation are mainly from 10 a.m. to 2 p.m. Okay, skin is having 7 dehydrocholesterol. Skin is having 7 dehydrocholesterol. 7-dehydrocholesterol is a raw material present in your skin. When ultraviolet B rays fall on your skin, this got converted into cholecalciferol. Cholecalciferol, and this is called as vitamin D3. Sometimes we are taking the supplement. This is the supplement. If you are not exposed enough to sunlight, okay, we are forced to take these as a medicine. Otherwise, we must go to the sunlight at least in the morning. Also, there are few ultraviolet B rays. They can form vitamin D3. Even if we have 15 minutes of exposure in a day between 10 a.m. to 2 p.m. Okay, but a vitamin D3 can be formed. So vitamin D3 is formed only in the presence of sunlight. There are plenty of other benefit also. So this will go in the liver. In the liver, this cholecalciferol is converted into 25 hydroxy cholecalciferol, which is also called as calcidiol. Calcidiol, and it is the major circulating form in the blood. It is the major circulating form in the blood, but this is not an active form. Okay, this is not the active form. Then it has to move to kidney so that 25 hydroxy cholecalciferol is converted into the main hormone 125 dihydroxy cholecalciferol, and this is the active form called as calcitriol. Calcitriol in presence of enzyme 1 alpha, in the presence of enzyme 1 alpha hydroxylase and the hormone parathormone. This is very important. So although the calcium absorption in the intestine is only dependent on vitamin D3, but this vitamin D3 activation is in the presence of 125 dihydroxycholecalciferol will be formed only in presence of parathormone. Parathormone. Okay, that is why, my dear doctor, parathormone is very important, and we are saying that parathormone has indirect role in calcium absorption from the intestine. So coming back to the topic, parathormone has direct action on the kidney and on the bone. On the other hand, I am telling you, in the intestine, calcium absorption is only dependent on vitamin D3, but this vitamin D3 is activated from 7-dehydrocholesterol only in presence of the hormone parathormone. So I hope you, if you know this much, you can write a lot about calcium homeostasis. These are the flowchart and the conceptual diagrams which can help you in writing with the diagram, with the flowchart, with the headings and all. A lot you can write. Is this clear, my dear doctor? I hope there is no doubt in calcium metabolism. Now, this is the summary. At last, this is the summary. So whenever plasma calcium is less in the blood, thyroid gland will be activated to release para, will have direct action on the kidney as well as on the bone. Direct action. Okay, so in the kidney, it start absorbing calcium, as I have discussed in detail. And also in the kidney, help you in calcium absorption from intestine. So in intestine, we have indirect in the calcium metabolism, and at the last, not the least, the receptor of parathormone are G protein couple receptor. They all are mainly G protein couple receptor. They can be GS, they can be GQ. So whenever parathormone are acting on various organ, various tissue, they will act on either GS or GQ. When they act on GS, the secondary messenger is cyclic AMP. ATP will convert into cyclic AMP, and cyclic AMP will increase, and this cyclic AMP will cause lot of physiological action. On the other hand, if they're acting on GQ receptor, they will convert phospholipase into IP3 and DAG, and IP3 will release calcium, and free calcium is the secondary messenger here, and will act as a secondary messenger, and it will cause various physiological action. Clear? So this, in just I think 10, 15, 20 minutes, we have discussed calcium metabolism in total detail. We have not missed even a single point. If you can understand this much, you can write around about calcium metabolism in the long question, in the short question, and also you can solve all MCQs which are related to this calcium metabolism. I hope this is clear. If you have any doubt, you can ask me. So purpose of taking this Tuesday session is that we will take only 20-30 minutes of yours and we will try to give you more and more concept. And if you want to go in more detail, you can download the DocTutorials app. So in the MBBS curriculum app, we have everything in the 3D form. All the animations are done. For example, I'm teaching here. So these all diagrams are in animation form. How this osteoporosis is inhibiting the rank ligand, all that can be visually seen. So you can download DocTutorials app and you can go to MBBS curriculum and you can see there are a lot of free videos over there. You can see to that videos, and any doubt you can contact me through Telegram group of DocTutorials. So I think it's all. This is all. So thanks a lot, my dear. We'll meet you next Tuesday. Till then, bye bye. All the
Recording stopped.